see the actual text, then more amendments and more conversation begins. We've got a long way to go, Nancy.
Kelly O'Donnell. Thanks, Kelly. I appreciate it. Now let's bring in some people who really are going to have to come public about their support or lack of it. Let's start with Democratic Senator Mark Warner of Virginia, joining us from Capitol Hill. Senator, thanks for taking the time.
Thank you, Nancy.
Has there been an advantage for the Senate, for the Finance Committee to sit back and watch what's happened over the summer with the House committees and start to formulate language, frankly, that might be more palatable to both sides?
Well, I think we've all been anxious for the Senate Finance Committee to work, but I do think they're going to have the benefit of where the hot buttons were in the earlier Senate help bill, where they were in the House bill. They've heard folks in terms of the reactions at the town hall meetings. And, and I, along with I think most of the Democratic senators, and I know all of our freshman Democrats who urged Max Baucus to try to take the extra time to get this bill right. Let's try to have a bipartisan bill, because when we're taking on changing, particularly the financial incentives around 1/6 of our economy, the whole healthcare industry, we've got to make sure we get it right.
I want to go back to this immigration issue, because I think Kelly's touched on something that a lot of us haven't thought about. We know what illegal immigration looks like, but what if you are here legally, but you're not a U.S. citizen, yet you pay your taxes and you pay by the rules? Are you going to be able to get coverage?
Well, I think what they're talking about is if somebody is here as a legal resident, should they be able, if they want to use their own money, to be able to buy into insurance that would be offered on the exchange? I don't understand how that would bother anyone if they're actually going to use their own money. I think some of the folks who've been raising these concerns, and I, for one, don't want undocumented persons here to be covered, and I think all the bills will continue to reaffirm that. But I think folks need to remember, under current existing law, if somebody shows up on an emergency room doorstep out of a car accident, we don't check their legal status, we don't check whether they've got insurance. So the system right now is already paying for illegal immigrants health care if they access health care through the emergency rooms in the country already.
Senator, from what you understand that we expect to see in this bill, is there anything you want that you're afraid might not be there?
Well, here's where
you individually.
Here's what's driving me the most is how do we not only have this healthcare reform paid for, but how do we make sure that we start driving down our healthcare costs overall? Because one of the things that has not been part of the debate has been what happens if we don't act? The biggest driver of our federal deficit is healthcare costs, Medicare and Medicaid. If we don't act, you're going to see insurance premiums double. If we don't act, you're going to see American business be less competitive on a global economy, because we have to pay $3,000 more per employee in our built-in healthcare costs versus our competitors abroad. So we've got to drive down costs, which means I think we need to move away from our fee-for-service basis around healthcare, try to actually reward hospitals and doctors who provide quality, not quantity of care. And I want to make sure that the plan that the Senate Finance Committee is coming out with really takes that giant leap. Driving down costs is far and away, to me, the most important thing of this whole debate, because if we don't get that right, then everything else, even if we extend coverage, we're still going to be in a financial morass.
Yeah, and figuring out how to drive down costs, still be responsible, and frankly, get some decent medicine, get what you pay for, put some value back in all of this.
You're right,
Senator
Nancy,
Warner. I appreciate your being with us.
All right, thank you.
Go ahead.
I was just going to say, Nancy, one of the things that we could use, there has been healthcare reform that's been going on in this country over the last 5 years, where certain large companies with large employee bases have actually driven down costs by putting in wellness, putting in prevention. Companies like Safeway Food Stores out in California has got some remarkable data.
Right.
Companies like Pitney Bowes, companies like Dell Computers. We ought to be taking some of the best examples from the private sector where actually healthcare reform is taking place in America and use that as the model for some of our Medicare and Medicaid plans, and try to bring those best practices to drive down costs across the whole system.
And on that note, Senator Mark Warner, thanks for being with us.
Thank you.
We're going to take a look now at where